Now, as we have done for multiple weeks at this point, and we definitely appreciate him taking the time to do this with us, is our good friend from Mercy Health, Dr. Dennis Norem, joining us to discuss COVID-19, where we are, where we're going, anything new that we may have gleaned over the last week or so. Dr. Norem, good morning.
Good morning to you guys.
How was Father's Day for you?
It was great. I heard from all 5 of my kids, and they're kind of spread out. One in Alaska, one in Arizona, a couple here in Chicago, and one here in Rockford. So
he's just sending Norems all over the country.
That's right. Yeah. He's dispatching his emissaries across the 4 corners of the nation just to make sure that we are covered. Even the big frontier up there in Alaska.
Yes, and fortunately, COVID-19, things have really calmed down in Alaska. However, my middle daughter's a nurse practitioner in Tucson, Arizona, and that's a real hot spot right now.
You know, it's different. We keep reading, hey, these guys are showing off better numbers than they've had before since we've seen in March that we're seeing hot spots flaring up. And then we see this one. An Italian infectious disease doctor believes the coronavirus has become less dangerous and could disappear on its own without a vaccine. Now, he is meeting some serious blowback from other people who are also considered experts in this. Dr. Matteo Bassetti, head of infectious disease clinic at San Martino Hospital, said the virus appears to have become less potent, possibly due to genetic mutations.
Well, interesting theory, and we'll underline theory. There's a thought that the virus became a little more aggressive with an initial mutation. Not clear when that happened, but it's possible that the virus can mutate somewhat into a less aggressive bug. I don't know that we've seen that yet with it popping up across the country and still spreading. It certainly hasn't happened here in the United States, and it certainly hasn't happened across the world with hotspots in South America and resurgence in a couple of areas in China. So I think that's a lot of wishful thinking that this virus is going to mutate into this benign virus and go away.
Yeah, the only numbers that I'm looking at that they're talking about lower is they're Russian reported numbers, so you can do what you will with them, but they say that they have had the lowest death count since sometime in March.
Yes, and I think your point about Russian numbers is you have to take that, too, with a grain of salt. Actually, with any country, there's a lot of political pressure in terms of reporting numbers and deaths, no matter where you are in the world.
He says it was like an aggressive tiger in March and April, but now it's like a wild cat. Even elderly patients aged 80 or 90 are now sitting up in bed. They're breathing without help. The same patients would have died in 2 or 3 days before. Another expert, less optimistic, saying it could take years. I don't expect it to die out quickly, according to a doctor whose name I cannot pronounce at Exeter Medical School. It will if it has no one to infect. If we have a successful vaccine, then we'll be able to do what we did with smallpox. But because it's so infectious and widespread, it's not going to go away for a very long time.
Again, I think we're back to thinking this is somewhat like the flu viruses. This very aggressive initial virus that we have no immunity to is spread very dramatically. Down the road, it will be something that maybe just flares up in much smaller numbers, and we'll have a vaccine and have a better treatment. We'll be able to deal with it. Again, we just don't know. Time will tell.
Staying on this mutation topic, 2 things. One, how likely is it, do you think, or do you know that a mutation is possible down the line? And 2, what kind of a monkey wrench does that throw into our quest for a vaccine? Does that throw everything away, or can we just kind of start, if something mutates, can we start from where we were before and build on it from there?
Very good question. I believe that you expect this virus to mutate. The question always is, will that mutation cause a vaccine to be ineffective? Depending on how the vaccine's made, it may or may not negate the vaccine. This new method of making vaccines will be more effective than our old method in terms of mutations. In fact, we'll probably see a different vaccine for the flu in the future that may be multi-year effectiveness because of the way it's being made.
I'm looking at a piece from Reuters that says Thai trials of COVID-19 vaccine have reached the make or break stage. They've administered, scientists or doctors in Thailand have administered a second dose of an experimental COVID-19 vaccine to monkeys at the tail end of last week, looking for another positive response to enable clinical trials on humans as early as October.
Well, that's encouraging. And again, we have to remember that there are, I think I read, numerous vaccines. There may be 200 different companies and organizations across the world working on different vaccines. Obviously, some of those are not going to be effective, but hopefully in this country we have enough different companies and researchers working on vaccine that several of them will be effective.
This is going to seem like somewhat of a bizarre question, but when they say they're ready to make that jump from trying it out on monkeys to trying it on human trials, how does that work? Is that a volunteer effort?
Yes, I believe it is. It's a phase 3 trial, and those you have to get, in most countries, you have to get consent from the volunteers to go through that. So I'm sure there's going to be enough volunteers given the seriousness of this disease.
You mentioned hotspots, some rises in positive cases. Some of the big ones. I think Florida's announced, I think, 3 straight days of record number of confirmed cases. Arizona's having problems too. Obviously, we are testing much more than we had in the past. So that obviously means you're going to have a lot more cases. Has the increase in cases compared well to the increase of testing? I know our values are floating around right now. We're getting them around 2. What do you have to say about the increase of testing and our increase of positive cases?
Well, clearly the increase in testing has brought forth increase in positive cases and reduced the death rates percentage-wise, but if you look at those hotspot areas, I think that's really based a lot on hospitalizations. There were several reports over the weekends of different hospitals in areas of the country, I think one up in Washington, that are running out of ICU beds. And that's more the worry. And I think from what my daughter said in the Arizona and clearly in the Phoenix area, I know they've been hit hard and they're worried about their capacity. So we talk a lot about increased numbers, but the key is talking about hospitalizations, obviously.
Yeah, you mentioned the hospitalizations kind of going up, but deaths from the disease have remained relatively stagnant, if not falling a little bit. Does that just mean we're testing a lot more asymptomatic people? What does that mean, that the deaths not necessarily going up?
I think there's many factors there. I think there is improvement in treatment. I think the combination now on one of the treatment regimes has been shown to be much more effective than what we've had in the past. It was a combination of the dexamethasone, which we mentioned last week. They give vitamin D, and they put people on blood thinners early on. And that seems to be helping reduce the death rate because it reduces the necessity of putting people on ventilators. And now we do have the convalescent plasma that we get from people who've recovered. That also seems to be more effective. So as we've moved along here, we do have some improvement in treatment. And also there is that antiviral drug, remdesivir, which is a little bit more available in terms of treating the sicker patients. So I don't hear a lot about treatment right now, but I believe we're seeing some benefits from that combination.
How does it, real quick, how does an antiviral drug work? We've always heard that, viruses, there's no real defense against it, but then we hear things about antiviral drugs. What does that do different than other drugs?
Well, not being a virologist, the easiest way I can explain it, I think, is it glops on to the genetic material that allows the virus to transmit itself into the host cell and replicate. So it interferes with that system in a couple different ways.
So it doesn't...
Because remember, viruses can't live on their own. They have to replicate within a host cell.
So it doesn't necessarily wipe them out. It just prohibits them from replicating.
Yes. So eventually, then the theory would be then the virus itself would not be able to replicate, and it's going to become ineffective or dead, if you will.
Gotcha.
Dr. Norm, you mentioned vitamin D a couple of moments ago. New European research I'm looking at here has added to the growing body of evidence which suggests a vitamin D deficiency could be linked with developing a more severe case of COVID-19.
Yes, and I see that a lot of places are now using vitamin D as part of their treatment protocol. We think that low levels of vitamin D definitely affect the immune system. So that would make some sense that giving vitamin D may give you a little boost to your immune system.
Now, for people who wonder, does that mean what? I just go out and get some sunshine, try to get some of that? Well, apparently you're not getting enough of it through sunshine, so a supplement would be in order.
Yes, and it's been of interest in my career that vitamin D was always of interest in bone health and more in women. We always heard about women and osteoporosis, and they should be on vitamin D. What I found now as I've gotten a little further along, a number of men are low on vitamin D, and including myself, I discovered a few years ago, and I take a vitamin D supplement. So it's worth talking to your physician. It's easy to check vitamin D levels, and supplements are inexpensive, and you can buy them over the counter. And it's probably much more important than we realized many years ago.
Any risk of taking vitamin D if I don't need it?
Unlikely, however, you can get too much vitamin D. If your levels get above 100, which can cause some toxicity since it's a vitamin that's stored in fat, there is a small risk if you just go gung-ho and take way too much. So I would not recommend people take more than maybe 1,000 units a day without discussing that with the doctor.
Yeah, looking at this, main consequence, toxicity, buildup of calcium in your blood, cause nausea, vomiting, weakness, frequent urination, might progress to bone pain and kidney problems, formation of calcium stones. That sounds very unpleasant.
Yes, not the kind of thing that you would want for anybody. So, again, discuss it with your physician. Again, easy to check vitamin D levels.
One other thing I want to ask you about, we've heard all along, second wave. The second wave, they want to get baseball done before the second wave begins. Now, they're probably not even going to get it started, but that's beside the point. Second wave, and the Associated Press has got a piece out this morning saying second wave. No, we're still in the first.
Well, I think absolutely we're still in the first wave. I'm not sure how you define second wave, but generally, I think most experts think that's something that's going to occur late fall, early winter, if it does occur. One hopes that maybe if we can keep this thing sort of suppressed and keep it at a low level, the second wave won't amount to much.
All right, doctor. Let's get controversial here. I opened this segment here with a clip from a podcast I heard over the weekend of Bill Burr. He was on. They were talking. Started to get into masks, mask usage, and Burr basically said, no. We're not here to talk about this. He goes, I don't have a medical degree. The guy he's talking to, you don't have a medical degree either. We don't know anything. He goes, what I do, I just check in every other week with a medical professional. They say mask, no mask, okay, and that's what I go with. So you are our medical professional, Doc. Mask, no mask right now.
Mask, absolutely. Okay. Another study over the weekend, I think U of I and a couple other places are doing droplet studies on masks and had some good recommendations. But clearly, it's back to the most likely transmission situation is person-to-person droplets, which is the spit basically coming out of your mouth when you talk, sing, yell, holler, whatever. And those droplets are the most likely source of infection. And the best way to avoid those droplets is to wear a mask.
And we're still kind of in agreement that just being outside doesn't necessarily mean throw on the mask. It's just kind of when you're around people. If you're, walking down the street by yourself or in the woods, we don't need to, you don't necessarily, you can if you want, obviously, but you wouldn't highly recommend that. It's just when we're going
no.
Okay.
And again, the social distancing, those droplets fall to the ground, and that 6 feet is seems to be pretty reliable. Those droplets probably fall to the ground within 2 or 3 feet. So if you keep that 6-foot distancing, if you're outside, you're probably at very little risk. Even indoors. The concern, I think, indoors is ventilation, air not moving, and there's some concern that aerosols, which are very microscopic little particles, which are floating in the air, which persist much longer, may still be infected.
Yeah, you talk about recirculating air, and I think a lot of people are worried about, like, maybe taking a plane trip. Does the virus survive a full-on, leaving your mouth, going through a system, and then being redistributed to somebody else? Will the virus stay alive and effective through that whole procedure?
Well, it could, depending on what the recirculation system is. If there's an effective filter, then I'd say no. If it's just somebody running the air through a big tube and spitting it back out, it probably could survive in that little microscopic aerosol. However, as you mentioned last week, it looks like airplanes are probably halfway down on the list. They're not the highest risk area any longer, and they're doing a much better job of sanitizing the airplanes, requiring everybody to wear masks. So I think that's a little less of a concern.
Yeah, so maybe we start playing baseball on airplanes.
There you go.
Yeah, okay.
There you go.
I think we figured it out. A lot of bunting. Dr. Norem, as always, we appreciate the time. We appreciate the expertise. And if you're willing, we'd love to talk to you once again next Monday.
Absolutely, guys.